Hello, my name is Hanna Konarzewska. I'm one of the cardiologists at Benefis. I specialize in rhythm problem, implant pacemakers and defibrillator, and I'm happy to answer your question regarding arrhythmia devices or general cardiology and preventive cardiology, which is actually my passion. Feeling skipped beats or a little forceful beat in the heart is a very normal occurrence. It actually only very few people out of general population don't have those extra beats. We do not know why some of us feel them more often than the others, but that's what happens. I have learned over the years that sometimes not having a good night's sleep, being under stress, having a lot of coffee or carbonated drinks, spicy food make you more aware of arrhythmia. As long as those happen at rest and are infrequent, you don't need to worry about it. Actually, no one needs to worry about it. But if they are very frequent, we may help with some medication or relaxation techniques or giving the hints about the diet changes or physical activity changes, which may help one more comfortable. That is because our heart works all the time and we don't feel it. So feeling it may cause anxiety, and that's probably the only problem with those extra beats. Well, menopause is not a disease, as we know, it's a normal process. However, change in hormones um, changes the vascular stiffness and also some symptoms related to menopause, like a palpitation, hot flashes, is not pleasant. That saying, with menopause we tend to gain some weight. Gaining weight can lead to hyperlipidemia, diabetes, increased blood pressure, and those are risk factors for heart disease and strokes. So it is very important that we change our diet, we exercise more, and especially pay attention to food rich in calcium and vitamin D3 and also phytoestrogens. The facts are that let's say Japanese women or Far East ladies who have diet rich in those phytoestrogens are less likely to have perimenopausal symptoms. If you do have a very rapid heartbeat, and I'm talking about heart rates 150, 160, 170 or higher per minute, it could be two of the reasons. One, arrhythmia called supraventricular tachycardia, which is a arrhythmia related to extra electrical connection in the heart. It's more nuisance than the disease, but it's easily treatable. And ever since we've developed procedure called ablation, we recommend it so you don't have to worry about it. It is not going to cause heart attack or stroke. It's more nuisance than a disease, but it can cause blood pressure drop and passing out episode, and you can hurt yourself if that's happening. The other rapid heartbeat can be due to atrial fibrillation or flutter. Those are a bit more serious because they can lead to the stroke, and definitely evaluation by cardiologist and sorting out what kind of a rapid heartbeat it is important. If you have already had heart attack, ventricular tachycardia, rapid heartbeat coming from the lower chamber may be present. Those are quite dangerous, and everybody who had heart attack should be under the care of cardiology, and those things need to be discussed and evaluated further with monitoring. It's a difficult question. If I knew how to make my patient eat healthy and exercise and take good care of their heart with preventive measures, we wouldn't have to treat that many heart attacks and strokes and diabetes and hypertension. I have learned over the years that nagging and trying to scare people is not really a good way of working on change of behavior. Positive reinforcement, mentioning it with love and care, and maybe psychological helps. There are some support groups here and there online. There are definitely showing the better way of eating so the weight can be decreased. Exercise is actually one of the most powerful antidepressant intervention, and obesity is quite often due to psychological problems like depression, lack of self-esteem. Unfortunately, high school can be brutal, and not keeping up in physical activity is not something we want to have. So I wish you good luck with helping your son to lose some weight and improving his long-term perspective. For a long time, we believe that there is such a thing as metabolically healthy obesity. Recent data shows up that even people who don't have high cholesterol, don't have diabetes, but are substantially overweight have higher risk of cardiovascular disease and also die earlier than they would otherwise. So yeah, keeping healthy, keeping lean, keeping exercising is a very important part of life. As I said before, my passion is preventive cardiology, because there is really much more we can do with preventing heart disease than treating them down the line. And the best way is to make sure that from early years we eat healthy, a lot of vegetables and fruit, not a lot of processed food. Stay away from simple carbohydrates, a high-fat diet, sugary drinks. You know, it's better to have orange than a glass of orange juice, definitely, because you have a fiber with it. That we exercise, that we encouraged our children to exercise from early age on, just by play, by ball, riding bike, swimming, things like that. So we have those habits down the line. One of the most powerful preventive cardiology things is not smoking. Smoking cessation decreases risk of cardiovascular disease or heart attack or stroke by 50% in the first year alone. We have no other intervention which is as effective. All the stents, all the medications we are giving, none of them decreases the risk of having event by 50%. So do not smoke, eat right, exercise, sleep well, be happy, and have friends. That's the best way of avoiding heart attack. Aging and family risk factors cannot be avoided. So just doing what can be done is the most important thing. There are people who have congenital hyperlipidemia, hypercholesterolemia, high lipid levels, and those cannot be managed with diet and healthy behaviors alone. For those, we do need to use medication before, because no matter how vigilant about eating healthy and keeping clean, you are going to be at an increased risk of heart attack and stroke, and medications need to be used. One of the myths about side effects of statin is that it causes muscle pain. There's a very, very small population of people who take statin who do have real side effects from it. Unfortunately, we all have aches and pains here, and sometimes it's easy to attribute it to the medication we use. There is one non-pharmacological agent, so-called red yeast rice, which is actually naturally occurring statin, and some people have a good results with that if they really don't want to take statins, and sometimes there is less side effects. However, the only population really studied with that were people from Far East. So I don't know how much it applies to the Montana population. If you do have palpitations, skip beats, rapid heartbeats, those Apple monitors, Apple watches, the apps you can put on the phone, or the one approved core cardio mobile are a good way to screen. They may not be as accurate as monitoring we are offering in the office, but they are easy to use and everybody can use it. With Apple application or Apple Watch, the diagnosis is quite often inaccurate, but it does help us if you come with those devices, and they show how fast the heart rate was, whether it was regular or irregular. It just makes the further evaluation more simple and straightforward. So I do. Everyone who does have it already is encouraged to use it, and I really like when someone comes with that and shows me their rhythm strips or their heart rates and blood pressure recorded. So yeah, even a little Fitbit is a good device. With the position change, the heart changes position in the chest wall, and sometimes when people lay on the left side, it's getting closer to the chest wall, and sometimes when they are lay on the right side, it happens, and that's why you feel your heartbeat more. With mitral valve prolapse, you are prone to have a little bit more of those extra beats, but that's just your heart touching the chest wall and making you more aware of what's going in the heart. As I've talked about before, we don't feel our heart beating, so it's an unpleasant situation, but there's nothing abnormal about it. Take position which makes you more comfortable and does not end up with you being aware of every extra heartbeat and a regular heartbeat, which is there otherwise all the time but not felt. Thank you for submitting your questions. If you have any further questions or problems, you can give us a call, and office number is 455-4320. You had always talk to your primary physician first. It sometimes answers the question easily and will save you the trip.